Welcome to the Depressy podcast.
I'm Missy.
And I'm Allie.
And we're sisters
in mental health fields.
Talking about all things stressy
and depressy. I feel like you have a big stressy depressy, kind of.
Yeah, I feel like this is, maybe I should just have my update, because I don't think this is a different category. Yeah.
This is a different category. This is just real life. It's not even it's lighthearted in the sense that we've acknowledged a billion, million, trillion times that this is so much easier than the other side of what's going on.
Yeah.
But that it's still genuinely something that you're going through and is taking a big toll on you right now. And from my side, I'm of course I don't know this other person, so I'm I don't care about them, I just care about my sister, so I'm just watching you and feeling bad for you. But also very proud.
That's very cryptic. We'll update people in a moment. Did you have something you wanted to say before I update?
Oh, well now I feel yeah, sure, because then people will be on the edge of their seat.
They're what are you referring to?
What are we talking
Especially if you're not listening to every episode religiously, which no shame.
I know, in my brain I'm oh, of course they know what we're talking about because
they listen to every word we say.
Yes. Okay.
Basically, as we talked about last episode.
I thought I was gonna go so they would be on the edge of their seat and have to listen.
Okay, you can go. You do it. Yeah.
Okay. And I'm going to just provide some life updates. So everyone's just going to have to wait and listen. Okay. I have a captive audience right now. Yeah. What is Missy? Why does Missy have a procedure tomorrow? We'll get into it later. Okay. So I will say my minor stressy depressy, I have two. I can never just have one. But okay, I'm going to start with one that's flat out. Okay. Today I was cleaning the stove and I picked up, it's a gas stove, so you have the rails that I picked up, I put it over the sink, and then there's these circular things and this black circular thing that sits on top of this gray thing. So I lift up the black thing, and there in the circular, now silver thing, is one dead cockroach and one alive cockroach.
No!
And, this is how I know that either I am handling stress very well or my SSRI dose is just great. Because I was just okay, let me just spray it with cleaning solution until it dies. Of course it doesn't die. What I will say is it's one of those small cockroaches. Much better. Much more palatable. Not to eat, just in vibes. The ones that are I don't know, a couple centimeters, small.
Yeah. Yeah.
But they are cockroaches. I think they're called German cockroaches or something. So yeah, it kind of just fell in the sink and then went down the drain, and I'm okay, bye.
Have a good life.
And then I lifted up the stove top. This is I'm being so brave right now. I lift up the stove top to look if there's more under, above the oven. There was nothing. So I just kind of clean out the crumbs. I don't know. But that gave me such a fright. Okay, wow. The other one. Both these have to do
You're
with
always
insects.
finding bugs when you clean in crazy situations.
I get this has to do with another bug.
Wow. Okay.
You see, this, and it's crazy. It truly energized me.
Wow.
I'm going to tell this full story. Again, I have captive audience. I've told this story so many times because I feel like a hero, even though I did nothing. Okay, I'm walking. I went on vacation with Lucas, Alex, our brother, and then my sister-in-law, Sammy, and my brother's girlfriend. They're not married yet. Whatever. Not important to the story. Okay, we're walking for seashells. What's important to the story is that we are very serious about seashells. And if you go too close to where all the resorts are, all the seashells are gone because everyone's there. Sure. So we are walking and we are a good 10-minute solid walk away. We're not slowly walking. We're hiking to this place. All of a sudden, Sammy's a little bit in front of me. I feel this sharp pain in my foot. I scream. I'm how? A little louder than that, but it hurt.
We won't alarm the pod listeners.
I thought that I had stepped on I don't know what, some kind of needle or something. It truly felt like something super sharp just stabbed me, a push pin or something. And I am standing on one foot now. I pick my foot up and I realize there's a bee on my foot. And oh my gosh, I've just been stung by a bee. The most dramatic thing that could ever happen to a girl. And so I look at Sammy and I go, oh my gosh, I was just stung by a bee. One of the bravest things that I've ever witnessed in my whole life is that she took the bee with her fingers and flicked it off of me. Now, we didn't know if it was a wasp. We didn't know it was truly a bee, because we knew it was once she did that, because the stinger was left behind, and that's, like,
yeah,
the bees lose their stinger when they do that. It was kind of sad, because then it was just on the ground and, like, curled up and died, and I was like, wrong place, wrong time, buddy. But then she takes her little, she's, like, kind of longish nails, she takes it, and she, even though my foot is covered in sand, so it's hard to see, she gets the stinger out and plucks it. And then she's like, do you want to keep looking for seashells? Do you want to go back? I was like, no, let's continue. So I felt very brave that.
Wow.
And I just want to share for the listeners that it has, like, truly cured a fear of bees in me. Because while that,
exposure.
Yes. Truly exposure therapy. Because, okay, was it pleasant? No. But I don't know what I thought it would feel like. I thought it would be like, oh, now for the rest of the day it hurts. And maybe if I were, like, allergic or something, like, or had more of a reaction, or Sammy didn't get out the stinger right away, like, would have been worse. But it truly just felt like I stepped on something sharp. It felt like a sharp, like, maybe like you're getting a shot. Sorry, Missy. But anyway, probably felt like that, but, like, obviously you're not expecting it, so it's, like, shocking. And then it felt like maybe I had, like, a paper cut there. And so, like, when I was touching something, it kind of irritated it. Like, the way that you would if you got any kind of, like, cut, which kind of, so it really wasn't that bad. I would rate the whole experience like a 2 out of 10 on a scale of pain. Quickly subsided to a 1 out of 10. So yeah, I just want to share that. Stressy depressy just because it was kind of crazy, but I'm glad it happened. And it made me a braver, stronger person.
Wow, not all heroes wear capes.
I know. I tell this story like twice a day to people that have already heard it. I just actually texted in the group chat that I have with my brother and sister-in-law and Lucas. Do you remember when I was stung by a bee? Like, that's what I sent this morning. I sent that text probably a couple times this week, and it happened about a week ago. So yeah, it's like a new personality trait for me that I was just stung by a bee. I feel like the world is separated into two people, those who have been stung by a bee and those who haven't.
I have not.
It's actually my second time, but I think the first time it was a wasp. So first
I
time.
don't feel like I knew that.
It was at our cousin's house, our second cousin.
Oh, okay.
And they had, unfortunately, a yellow jacket infestation, which I don't know if that's a type of wasp or bee, but in their attic. But I still spent the night. That was like, cousin sleepovers. Sure. You gotta stick it out. Yeah. And I went to the bathroom, and we already weren't using one of the bathrooms because there's a couple bees in there. But I went to their parents' bathroom, and then I feel a pain. I look down, and there's a bee on my toe.
Ouch.
And that one hurt more. But I don't know if it was just because I was a kid and scared. I was probably like 8. And so I feel like I was really scared. And I remember I kind of like shook it and it fell off. And there was no like stinger left behind. So I don't think it was a bee. But yeah, Dad, like, basically, I know Dad had this experience as a kid where he got stung by like 15 bees.
A lot of bees because he got
like himself... a soccer ball or something, like got kicked into like the woods. He went and like a full swarm stung him. So I think it like both increased empathy and decreased it, where he was like, I've been through worse. I remember we went to the pool that day. And
my mom is also allergic to bees, yellow jackets.
Oh my gosh.
One of those. So this was always like, what if we're allergic?
Missy, have you ever watched My Girl? I honestly think another 2 categories of people in this world are those who watched My Girl before teenagehood, like as a child, and those who've never watched it or watched it later, because the trauma that basically, it has to do, someone dies due to bee stings, and it is a child. That is the one and only sleepover as a kid that I went home from early. Because after watching that, I was like, so my mom's gonna die. Like, that's what I just learned. Because I remember Mom is allergic to bees. Anyway, I know. But that is truly traumatizing. Oh, yeah. I definitely could not watch that now. But
wow.
But let me say this. I was 7 years old.
Shown that. Yeah.
7 years old. I'm just gonna say it and cut it out. At house.
Wow. Okay.
Yeah. And her mom puts it on like, oh, this is a good show. This is a good movie that I enjoyed as a kid too, or something. Although it wouldn't have been, whatever. And then she's like, I didn't remember how sad it was. It is.
Sometimes you have these fond memories from childhood, then you look back and you're like, that was kind of dark, or like,
Yeah.
you don't really, wow.
Anyway, I feel like a superhero that I survived a bee sting. So, anyway, so what I've been doing in my life, I've just been doing interviews, done with any in-person school, but I do have online classes, and I actually start an online class tomorrow, and there's supposed to be a synchronous session, and I emailed the person leading the class being like, I have an interview tomorrow, so I can't come, and she didn't email me back, so we shall see. But it's on transfusion medicine, and I'm interested. It's a 2-week class.
Very cool.
We'll see.
This is like part 2 of Allie being like, I'm done with medical school, and then it's like, actually I have a class, but it's online, but I started tomorrow.
I think I do gaslight myself that I am done, because I remember I'm like, I'm done. Like, I'm done with school. I have nothing to do. There's nothing for me to do. But then I realized I'm taking this class. I'm taking then a 4-week class for December in urology, because I just wanted to take an online class, and that was the only one. And then I have 3 more 2-week online classes.
When does it end?
I don't know. It's truly God gives his hardest battles
to his toughest warrior.
Soul. Okay, but speaking of God.
Oh my God. Speaking of divine.
God gave someone cancer, not Missy.
Yeah, Allie is just spewing so many things here.
It is a woman that we do not know.
Yeah. If you listened to the pod last week, you will have known that at that point I didn't actually know what was going to happen, but I was told that I was a match for stem cell donation to a woman, and that's all I know. I just know she's a woman who has a form of cancer. That's all I know.
I've made a whole picture of who I think she is.
I feel like I have too, but I don't know anything about. I actually was like looking back, because I was like, did I know these details? Like, I had like age ideas in my head, and I was like, they did not tell me any of these
things. In my
things.
brain, she's a 60-year-old woman who has like a daughter and a son.
Yeah,
who are both married. And one of them have kids.
I mean, regardless, I am a match. And essentially, I think I was saying last time, I didn't know if I would end up like having to move forward with this, because they often like, tell you you're a match and would you like to go through with it? And then they also might assess the patient's ability to receive the donation, or also like they might be trying a different treatment that's actually working. So then they say, okay, we don't need you for now. But I didn't know this at the time, but actually like the next day after we filmed, I got information that they really wanted to expedite it as soon as possible. So I am going to be donating what for me, and by the time this comes out, this will be well into the future. But at this point, while we're filming this, I'm actually doing the donation tomorrow. And so what that's meant is I had to do like a really intensive physical. And then I have been getting these injections throughout the week that basically promote, what they basically do is they like leach the stem cells from your bones. So what I'm experiencing, and a lot of people, this is like very common side effect, is that you kind of like your bones like kind of hurt. It's nothing that bad. It's literally like a 2 out of 10 pain. Like it's nothing horrible, but it does mean that like literally my husband earlier was like, how much would I have to pay? This may be niche. How much would I have to pay you right now to do the bend and snap from Legally Blonde? And I was like, I could not. No one could pay me to do that. Like, ow, that would hurt. So it's just like, managing all of that. And to kind of like circle back from last week, our topic was also talking about how I have a needle phobia, and I've been through exposure therapy for that, but I still get what's called a vasovagal reaction, which is just a separate from the phobia, a biological reaction where I tend to faint around needles. Typically for me, this is more so around like blood draws or IVs, because it's just more sustained, but I don't really get it when I'm getting a vaccine or injection usually. But lo and behold, basically what they do is they send a nurse to your home like every day to give you these injections. And the first day the nurse comes, she gives me the injection, and I just feel so lightheaded. Like I just know that this thing is coming on. And it actually lasted like longer than it typically does for me. I think maybe just because there's a lot of hullabaloo around this whole thing. And I think the nurse was also,
she's working you up.
She's working me up a little bit, because I think I can understand, if I had to get into her head, I could think like, she's the only medical professional in our home. She's liable for whatever happens to me. It did get, and if you know about vasovagal reactions, this is not actually that scary, though it sounds scary that like
No, it's
my
not.
blood pressure
It's,
dropped
yeah.
so low she couldn't get a read on me. And that was like for quite a bit, like for maybe like 20 minutes. Like it was really, yeah, I was just like feeling really woozy and lightheaded. But eventually I got there. But unfortunately, I think this is like maybe their protocol. She had to call like EMS to come to our
That
apartment.
was wild.
So we
I
were like,
just think this whole thing is wild. And I was talking to Missy about this. I was like, was she like a young nurse? Like, and this is not me judging because I was not in the situation. I
yeah.
didn't see you. I don't know her clinical experience. Okay. I don't know her clinical experience and whatever. But I was so surprised that she told you that I've never seen anything like this. I'm like, this is a classic
No, she said that
vasovagal
she's like
response.
for these injections. Like she's seen it
Yeah,
maybe in other.
right. But my thing
Yeah.
is like, how have you never seen a vasovagal response to like an injection? Like
Yeah.
that is crazy to me because like
I
I've
don't
seen
know.
them just being in the hospital for like a couple years as a med student. So I'm thinking like, why is she freaking out about this? Like you just
Yeah.
need to lay down. And I think what made it worse is that she's kind of freaking out and like having anxiety, and that's like not going to
She's
help
like, we
you
need to get the
recover.
EMS in here. I don't think
I
you
know,
should
and
go
you're
through with the
like, I can't
donation.
see.
I was like, no, 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 I have to go through the donation. I know that I'm going to be fine. And she was like, your health is, very important. I was like, this has nothing to do with my health. My health is a-okay. Like, I am good. It actually was like an interesting, I really had to get into the exposure mindset for the rest of these because this was, so every day I got 2 injections and this was injection number 1A, like first day, first injection, this happens. And it was like, okay, do I give you the second one now that all of this has happened? And every fiber of my being was like, absolutely not. Like, cancel it. It was just the even thought of being like, let's just cancel all of this. Like, it felt like this dopamine rush. Like, please, yes, let's not do this. I don't want to do this. This is so scary. Really just not fun to have that happen. But I just knew, I was like, Missy, if you don't get the second injection, this is going to cause a greater fear response for you. Your body's going to learn that you can't handle it, that this is so difficult that you're just not capable of moving forward. And I know logically that this is not something that's dangerous, even though it's scary. It's perfectly normal and it happens to people. And so and of course, what is helpful is just to know, like, I want to move forward with it to help save/extend this person's life who I'm donating to. So I really pushed to be like, no, I have to move forward, please.
And also, at this point, this person is going to get chemo and probably has been potentially already completed or
Yeah.
started, like, is
They
in the
had, I
process of,
think. Yeah.
yeah, completely wiping out their immune system. And if they do not get the stem cell donation quickly, they will die. So dropping out, of course, if there's a true medical issue, your health does come first, but it's like
It comes
once
with
you
a
sign up for
big
this,
consequence.
you're really committing. Like you really have to commit because now this person like really could die very quickly if you don't continue through this.
Yeah. So so that, of course, like that was always like no question in my mind, but even just from so to be clear, I was never actually debating not, but I could
But they
feel
were-
like my anxiety. Well, so the like Gift of Life, which is the like place that is facilitating the donation, the nonprofit organization, they were like it's, I mean, obviously, of course it's up to you, but like you're medically cleared, like you're okay to move forward if you'd like to
Right.
move forward now that you're doing better. They were not freaked out by it. It was this nurse who was like an outside contractor who was being
Right.
like, oh, I don't think you should move forward with it. So just to be clear, Gift of Life was very much like, again, you have autonomy, and if that's your decision, that's your decision. But like from our standpoint, they were like, you can move forward. And so I just knew, like, it was like this, my anxiety was just telling me, do not do it. Do not. That was so scary. Why would you do that every day? And I was just like, I have to do it. And I got the second injection. Obviously, my anxiety went up again and my blood pressure dropped a bit, but nothing similar. And I've gotten them now twice every day since.
I'm so proud of
And
you.
it's gotten easier. It's like, it really is the exposure thing where it's like, okay, I'm like showing myself, I'm literally showing my body, you can do this and you can handle it. Like you can get through it even if it's scary.
Yeah.
So hopefully that will apply tomorrow when I'm getting all this done.
Yeah. I am truly very, very, very proud of you. I also forgot that you were doing this, even though
my God.
I knew it, and I was kind of,
as we were joining, Allie was like snipping at me this whole time.
Okay, it's just, we snip at each other. Okay,
yeah,
it's not.
And I was like, before we film, I need to go get a pillow because my back is kind of hurting right now. It's a little uncomfortable to be sitting in this chair. And Allie was like, okay.
No, I think that you misread that though. I was just like, lol. I just thought that was funny because I thought you just like I have my pillow. You know what I'm saying? Like I just was like, she just wants to be comfy. But then you had a reaction and I realized, oh my God, that's.
I was like, my back hurts so badly. Just let me get my pillow and don't make fun of me.
Poor Bouquet.
Anyway, so it's been a wild ride. It's been an amazing distraction from internship applications, like waiting to hear about interviews. So
I really feel like you should be able to put this on your resume.
I know, it's such an interesting, I feel like being at this stage of my PhD, what the funny thing is I actually don't need to tell that many people because so much of my work is just on my own time. So I did tell my advisor, but I didn't even really need to tell her. But it is this weird.
Everyone.
It is this weird thing where I'm like, I think this
thing.
is like a significant thing in my life right now. I should just let you know I'm going through this. But also she would not my work. There's certain things that might need, but this is actually really not interfering with anything that would have been synchronous work hours for us.
Sorry,
so
my ears so itchy.
Anyway.
Okay.
So that's that. I do have a stressy depressy though. That's separate. That's a more legit.
Okay.
That I don't even know if I told you this. That our toilet stopped working. And of course, if anyone lives in an apartment building, you know that, and you rent, you know that it is just the runaround. 12 different people had to come to first fix it a little bit and then fix it a lot and then open up our entire wall so that they could redo the pipes. And then there was a different guy that was the tile guy, and then there was the plastering guy. And it's still not finished because basically the guy plastered. So our bathroom is right next to one of our closets where a lot of our clothes are. And so we had to take everything out of that closet. We literally, our whole bedroom right now that you can't see is just clothes and random stuff everywhere on the floor because that's where it has to go. And he was like, okay, I can't paint right now because the plaster is drying. We were like, okay, that makes sense. He was like, I'll come back tomorrow morning. Doesn't come back tomorrow morning. Of course he doesn't come back tomorrow morning. So then our super has been very, very on top of it, which is it's huge blessing. But he's basically like, okay, I think he'll have to come back during the week. But during the week, tomorrow is my donation. So we're like, that doesn't work. And then even once the paint happens, it's going to be another day of it drying before we can put our clothes back in there. So it's just overstimulating to the max to be stepping over things all the time. Literally, this was also the day of my first injection when the nurse came, the EMS came, these 5 different men came to fix our toilet. Our dog was like, what is going on? Literally, our apartment was just constantly, there were people here every other minute. But so that's just been annoying. And I just want that to be done. Yeah.
That is so annoying. I didn't realize it still wasn't done.
I mean, luckily our toilet works and we have hot water. That's nice.
Yeah,
but
that's the most important thing.
We just can't use our closet. And it's just annoying. It's just annoying more than anything.
Yeah.
Anyway, our topic for today. Yes. What's our topic for today?
Yes. Let me change positions. Okay. Topic for today is OCD. And part of the management process of OCD.
Yes. It's almost kind of a continuation from exposure.
It is. Yeah, because honestly, it's kind of similar principles.
Yes.
I will share I do not have OCD, but if you know, we talk about this a lot, that we don't think that you have to be diagnosed with something or meet full diagnostic criteria in order to benefit from some of the tools or therapeutic techniques. So it's something that resonates with you. I think many people deal with, even for a short period of time, anxiety can look like kind of obsessing over something or having intrusive thoughts that then lead to certain soothing actions to help ameliorate that. So it doesn't have to be
we should pause there on kind of the definition of OCD. I feel like you gave a good soft definition there, but what is OCD?
That's a great question. I don't know. I don't have the criteria in front of me, but it's kind of 2 parts. One part is an obsession, where the obsessive part of obsessive compulsive disorder. So that obsession can be well formed, or it can just be intrusive thoughts about certain things. So intrusive thoughts meaning not necessarily something that you believe or think. It's something that more pops into your head. And we all get those. A good example of that is like you're driving and you get like the sudden thought, like, what if I just
drove into the other side?
Drove into the side. Or what if you're standing on the cliff or something? What if I like jumped or something like that?
And you don't believe that you're going to. It's just this thought, this sensation that occurs to you.
Yeah. Or you get like an image in your mind that is something that you don't want to think about, like a graphic image, and you try to like almost like shake your head away. Like it's unwanted thoughts that you don't necessarily believe or agree with. And so everyone gets that, but the kind of where it becomes an issue is when it's more frequent and when it's interfering with your life and causing you distress. And that can lead you to the compulsive side of things, is that in reaction to this, you have a compulsion. So I feel like one of the more classic ones that I think about is like contamination OCD. So someone has an obsession, intrusive thoughts about germs or contamination of certain things, like dirt. Sometimes it's just more intangible, just things being unclean. Yeah. And then their compulsion will be to clean it to the point where maybe they're washing their hands like 30 times an hour. Like it can get really not productive, you know. But some like smaller things might just be like, you know, checking behavior. So you think, did I turn off my stove? Even though you may not even been using the stove like that day. Right. And you're like, let me just go back inside and check and make sure. That's the compulsion. And it can take so many different forms. Like I feel like when you think about it, you might even start to think of certain things that you may not have even considered in your life as a compulsion you do for anxiety. And I can talk about one that is my own, that I've actually have heard of other people having this, but I do think it's like pretty rare. So I don't know, not rare, but like I don't think it's super common. And you might not think that it's OCD or like an OCD type behavior because it's like not one of the more classic ones. So what I dealt with is what I would describe as pee anxiety.
Yes.
It's even hard to talk about because sometimes I go through periods where it's a lot better. So I feel like sometimes talking about it, I'm going to like make it worse, but I'm just trying
to. Well, that's magical thinking, which we could talk about. Is
like
also
if I put it more into my brain, then it'll be more in my conscious as something to worry about. Because I've almost like gone through periods where I forget about it. Yeah. But it is this truly, the best way to describe it is feeling like my bladder is not empty, but it is only an issue when I'm trying to go to sleep. So I would say I had it pretty bad as a kid. I would say this is like I would go to the bathroom, try to go to the bathroom like 7, 8, 10 times before I could fall asleep, and would just have to sit on the toilet until I peed a little bit.
Oh my gosh.
Which is really hard to do when you're on your 7th time.
This is like my dog marking every bit of our walk. She's like, come on.
Now it is not that bad as an adult, but it is so frustrating because I don't even know what my fear is. My fear is, people will say, oh, are you worried you're going to wet the bed? That is not my fear. My fear is that, get ready for this, I'm going to have to wake up in the night and have to go to the bathroom. I don't know why that is so aversive to me. I mean, who likes to do that? But that thought is like just so, I don't want that to happen. So I'm laying in bed, and now it'll be a thing where it's like 1 or 2 times. But it's a bad night if it's 2 times because, again, before I go to bed, I'm going to the bathroom. So within 30 minutes, to expect that my bladder is now full again is just not the case.
So silly.
But
yeah,
I feel like I have to go. It feels like I am like, no, but I feel my bladder is full. And of course it's not. I will swear to you that like, no, this time it's different. Like I feel that my bladder is full. So I'll get up. I'm so frustrated because I'm almost asleep. I'm like, I get up, I have to go to the bathroom. I'll get back in bed. Maybe I'll take one small sip of water. Like literally like get back in bed. 20 minutes later, oh my gosh, I have to go to the bathroom again. I don't have to go to the bathroom again. This is not like overactive bladder because then I go and sit on the toilet and just have to wait. to pee.
Okay.
Nothing's coming out.
Yeah. So you don't
And
have
sometimes
to go.
it'll take like 10 minutes to even get a little anything.
No, I mean, I feel like it's an example of where the behavior is what happens with OCD. It's all like training your body and your brain, right? So when you have this anxious thought, what if I have to get up in the night or whatever it is? What if the stove is on? You feel like this action is going to help get rid of it. And at first, the reason why it can turn into OCD is because at first it usually actually does work, where you're like, thank goodness I went to the bathroom and now I don't have to worry of this thought doesn't have to come back, right? Or I don't have to worry about the fact that I accidentally left my stove on. But anxiety just continues to grow and grow and grow. But your body has learned this feedback loop. I have to do this thing in order to make this anxiety thought go away. So I need to now check the stove multiple times, or I need to get multiple people to look and tell me the stove is off or something like that. Or now I need to go to the bathroom so many times before bed, even when I really don't have to go, because your body's like, this is the only path to not feeling anxious, basically.
Yes. So I do feel like it is a bizarre compulsion, but I have actually had a patient who had this, and I was like, oh my gosh, girl, you're not alone. I didn't tell her personally about that, but I was like, I get you. I was like, I have to take my own advice. But, yeah, it's strange. And I think when I'm sitting in bed, I think it's really hard to fall asleep if I don't go. Just like, I'm so frustrated that I have to then go to the bathroom. But like, I don't know how to explain it. I feel in my body that I have to go. Like, imagine you felt the sensation that you had to pee.
That would be hard. Yeah.
You would be like, how are you supposed to stay still? The issue is that it's actually not the sensation that I have to pee.
Yeah.
If that makes sense.
I think with OCD can be so all-encompassing like that. Yeah.
Any small pressure, anything, as I have to pee. That's the issue.
Your brain has convinced you. Like,
my brain has convinced me that this feeling that I'm feeling actually is my bladder being full. And I fully believe it. Because
it's just like tunnel vision on that thing. Totally. I mean, I think this is something that comes up a lot too, where it's like another form that OCD can take is just there's a lot of like risk management in it. Okay, like, it would be so much worse to have to get up in the night, so I'm just going to go now, right?
Yes.
Or it would be so much worse if the entire building like burned down because I left the stove on, right? So why not just check? And the issue is, again, if you, of course, in a one-off, like, fair enough. If you think you might have left the stove on, go check it. But like, if this is a repeated pattern for you, or same with the getting up in the night to go to the bathroom, you're like really tunnel visioning on that one thing. If you really think about it, there's risks that we take all the time that we're like, yeah, I could get into a car accident, so maybe I should just not go to my friend's birthday. I shouldn't drive. Anything you could just think of. Like, maybe I'll get sick at this event and I won't be able to, then attend my interview. I don't know. Like, we just are constantly taking these risks because we realize, like, okay, I have the facts here that like most likely it's going to be fine, and that part of living life is accepting a certain level of risk, and that if if I know previously I haven't needed to use the bathroom after one go to the bathroom, then that's okay. I'm just going to keep lying down and going to sleep, right? But what OCD is so powerful, it just like really retrains your body in a certain way to...
It really is powerful. Yeah. And I think the other issue is that you could say to yourself, well, I remember our friend who actually struggles with some of these thoughts be like, well, what is 1 second just to make sure that, again, what you're saying.
Exactly.
That the
this
stove
is really
off.
common.
What is 1 second versus this possibility that the thing is going to burn down? Well, it's not like a 50-50. There's like... Right. It's not like, okay, either this happens or this happens. Like, it is extremely unlikely, particularly given how careful you are, that you've left the stove on. But another thing, it is never as satisfying as you hope it is. That is something that I've experienced.
It's almost like a drug, and like it's a similar kind of principle where it's like every time you go to take another hit, it's like a little less satisfying. So then you have to like, it grows and grows and grows in a very similar way.
So that is, and I think we've all experienced, again, I do not have OCD, but I almost think that that's unhelpful. It's that there are certain things in your life that you might struggle with and that these tenets are applicable to. So I think of that with like health anxiety as well.
Yeah.
Because people say, why not just run the test? If you're worried you have, let's say, a brain tumor and you're so worried, why not just get an MRI? Okay, let's follow that logic. Let's get you an MRI. Well, there's actually some brain tumors that may not be picked up on an MRI.
Right.
Like, do you want to do like this other random test?
Yeah.
Well, actually, there's some things that may not be even picked up by that. Like, there will
and there's risks to these tests
be
too. Yeah.
100% certainty. You're never going to get to 100% certainty. So actually doing these serial tests when there's no evidence that that is something that actually is an issue, right? If you're like having some actual like problems, that's a different story.
That's one thing,
Talk to your doctor. But one, there's risks to running these tests. And two, no test is 100%. So I've found even like when I was having my stomach issues.
Yeah.
If I got a negative test, it was like, okay, well, what about this other thing? And then it could be like a couple months down the line, what if I've now developed celiac disease? Like maybe I didn't have celiac disease when the test was taken 3 months ago, but maybe now I have it. Like it is all of these things. I go to the bathroom, 20 minutes later I have to go again. You can never, doing the compulsions, you think that that is going to be what
because initially it does relieve
initially does.
Yeah.
But it never will get you there 100% and can just make the situation worse in terms of your worries.
Yeah, you kind of back yourself into a corner and then your whole life becomes about running these tests to see if you might have this like health problem, or you know, your cooking routine becomes much longer because you're constantly checking things, or you can't cook unless someone else is home to check with you, right? Or you know, are getting to bed much later and getting less sleep because you're using the bathroom, right?
There's so many examples. Like I'm thinking of just like, I had a friend who lives alone. She had a small like choking incident that she was so worried.
Yeah.
She like had to cut out certain foods because she lived alone, that she was so terrified of having this experience again, even though it's like, it was like truly a one-off thing.
Yeah.
But it got to the point where she couldn't eat at her house, like if she was alone. Like again, this is just like, if you give into it instead of showing yourself that you can do these things, it just grows and grows and grows.
Yes.
So yeah, there might be ways in your life that aren't just, you have to be super clean, or you have certain things that we just more commonly associate with OCD. There are just things in our life that sometimes kind of traumatic things happen. Like sometimes this can happen if someone has an allergy, that they get very scared that that's going to happen again. And sometimes it's just random that you develop a certain obsession and compulsion. I will say one other one that I have experienced is I'll get these, and it was particularly when I was on my OB-GYN rotation. I think because oftentimes I would be in this very sensitive situation where a woman is getting a pap smear or an internal exam. Or a breast exam, and I get this thought in my head, which I would never say. Like, of course, and that's part of what makes it so uncomfortable to experience these thoughts, is because it's so not aligned. It's like, what if I just said something like, oh my gosh, that's so gross, or like, oh my god, I can't even like say it out loud because it's so terrible. Like, just what if I just said something super judgmental or just so inappropriate?
Yeah.
Of course I would never say that, but for some reason it was like jumping in my head while I was watching this. So different than what I think. I'm like, I do not think that any part of this is gross. I do not, like, of course not. This is, first of all, just a medical exam or procedure. Like, not gross, very normal. I do not judge that at all. I don't know where these thoughts are coming from, but I would be so worried that I could accidentally say something out loud that I would have to like, and for the people not watching, I had to like suck in my lips, like biting my lower lip, just in case. Just to make sure that I wouldn't say something that I didn't believe or would ever want to be said. So
I know. And that's another common thing with OCD too, is people worry, like, because everyone gets intrusive thoughts, but there's certain people who I think become more distressed by them. So lots of people might get thoughts like that, like, oh, what if I just said this crazy thing right now? Or what if another common OCD like flavor can be people getting thoughts like, what if I just like harmed my child right now? And like someone who like would never ever do that. And some people have those thoughts and they're like, that was so weird. Obviously, I would never do that. Okay, moving on. But some people, understandably, because that's a very distressing thought to have, start to worry, like, does this mean that I actually am bad and I would have the capability to do something like this. I would never want to do that. And so they start to do a compulsion. Okay, every time I have this thought that I'm going to harm someone, purse my lips in, or I have to leave the room or tap something a certain number of times. I mean, it could really be anything. To like kind of make this thought go away. It's a really common flavor to OCD to kind of have this like guilt, like, oh my gosh, I'm not a bad person. I would never do this.
Actually, okay, another one I feel like I'm just like, people are going to be listening to this like, oh, she does have OCD. I would say I'm OCD curious.
Well, what I will say is I don't know if you'd meet criteria because, and we can get to this in a moment, you've managed these experiences quite well. So you've kind of followed principles of exposure.
Yes. Okay. This one I would say is probably the one I've had a couple experiences of this, but one experience I had, and this is going to be vulnerable, was like the most like judgmental I've ever, and the guilt that I felt for like even having these thoughts or thinking that I did something. So I would say I always have, when you were mentioning like the intrusive thoughts of hurting a child, I think this started when I was a phlebotomist during my gap year. Mm-hmm. I was a research assistant or like research coordinator or whatever. And I would go to the labor and delivery floor or postpartum floor after mom would have a baby. And oftentimes she would just be breastfeeding or holding her baby, and she would stick out her arm and I would put the needle in her arm. The baby is not even touching or near her arm. I would get this intrusive thought of like, what if I just stuck the needle into this baby's head? Terrible image in my head. I would be so grossed out that I even thought that. Why would I think that? But then I would position myself in such a way that it would be even harder. Like I'd be like, okay, I actually have to like stand this way just in case this baby all the way over here. Sometimes the baby would be in the bassinet on the other side of the room. What if somehow I slipped and fell on the baby? Okay. I was like able to manage that. But I will say, as a babysitter, whenever I'm holding a baby, I get these thoughts like, what if I trip and fall? Like, And I think that's a helpful thought in some senses. Like, it's a helpful idea.
These thoughts are all trying to be useful, but all the time we get thoughts, like, we don't realize it, but you are having thoughts constantly that you're probably just not even paying attention to. Because you're like, you're like filtering them out. Like, not necessary. I don't even really need to pay conscious attention to this. But some of us, for whatever reason, just pay more attention to these kinds of thoughts than others. And it makes sense. It's trying to be like, don't drop the baby just in case. Most of us might be like, I got it. I wasn't planning to drop the baby. No worries. But for some people, it's so distressing. Again, it makes sense. It's understandable to be like, ooh, I can't drop the baby. Of course I wouldn't drop the baby. Does that mean I might drop the baby, that I had this thought in my head? And then you're like, let me just sit down with the baby just in case, like,
yes,
or position myself in this other way.
When I was watching my friend's baby, who I love, like genuinely, it's my goddaughter, like I love her so much. I was watching her and she was in her crib and she was just learning to sit up and she fell forward and hit her head against the side of the crib. And truly, in my head, I thought I just did that to her. Like, I felt like I had hurt her in some way. It was like the idea that I had this story, and we're going to keep it super vague, but I had this story in my head of something that had happened to someone I knew. And I now was with a baby that I loved and was injured while I was there. And I started crying and literally freaking out. Like, I am so sorry. I don't know I don't know why I didn't realize at the time, like, why it was so distressing. But I do think there was an element of, like, thinking that this meant that I was a bad person. Like, I don't know.
Yeah.
So, like, I can't follow the logic of that, but I truly was so distressed to the point where I went downstairs and I genuinely cried and called Lucas on the phone to be like, I just injured this baby.
Yeah.
And he was like, no, she didn't. And I knew logically, but my brain was telling me, no, because I was there and she hurt herself, I did that to her. Like, and so I do think that's honestly something that I have to work on and think about more.
Yeah.
Is like my worry about injuring a child. Like, truly, it like felt like it was like confirming something to me. Like,
well, that
see,
is
you did hurt a baby.
Element of OCD. An element of OCD is magical thinking. We've kind of been alluding to this idea that people who like are more vulnerable to OCD or have OCD, these thoughts that pop, we have thoughts constantly. And our thoughts are not a reflection of like exactly who we are, right? It's just our brain is just firing things off all the time. And we tend to pay attention to ones that are like giving us more important information, and we consolidate them into like who we are and what our actions we'd like to take. But magical thinking is this idea that because I thought it, that means that must mean something about me, right? Or that must mean something about the situation. That because I thought I might have harmed this child, it must mean that I could be capable of that somehow.
Yes.
And like, even if you're not someone who has any desire at all, and in fact, that frightens you greatly. This idea of magical thinking of like, what if this thought means? And it could be applied to anything. I have a thought that the stove is still on, and that the magical thinking would be like, because I had the thought, it means it's like more likely or something like that. Anyway, but I feel like we should get into exposure to tell people.
I know. I feel like this was like my therapy session of just telling.
And we've been alluding to this idea. But similar, I think, to last week when we talked about exposure, the classic idea, I think, is like, okay, just do it. Like, don't just push past that anxiety and sort of white knuckle your way and just go ahead. And that is not actually exposure. Exposure we talked about it with phobias last week, but in this case is, again, doing it in kind of a measured, almost like scientific way. Your body has been trained to learn that the only thing that relieves your anxiety is doing this compulsion, going to the bathroom, tapping things a certain number of times, checking the stove, whatever it might be. Your body's like, that's the only route. That's the only route out. But doing exposure fully through helps your body relearn that your anxiety will go down with time. Because anxiety, just any feeling, cannot last forever. No one has ever been anxious forever. No one has ever been sad forever, happy forever, when you name it. And so even when you're anxious, the act of pushing past and just kind of noticing, not white knuckling, but kind of building up with like starting maybe small and kind of building up, as we talked about last week. Like, okay, today I'm going to like, I don't know, for the bathroom thing, I'm going to let myself go twice, and that's going to be all. And then you kind of like build down to what you want to do, or whatever it might be. Build up to help show your body, like, maybe I did get really anxious, but in 10 minutes, 20 minutes, that anxiety started to get down to a place where I can handle. And it's literally rewiring your brain to realize, oh, there was another escape route out of this. It's not just doing the compulsion. There's actually something else that over time I'm going to be okay.
Yeah. And sometimes that is like more straightforward than other times.
Yeah.
Like it's the most simple one was when I was like, you were like, don't do the thing with your lips. Like, don't cross your arms. Like when you think that you don't want to say something or do something, just don't engage. And it nipped it in the bud. Like, don't frequently experience that anymore. But with the other things, like having intrusive images come into your brain, or thinking that, oh, because I thought I might hurt a baby and the baby was hurt near me, that meant I somehow hurt the baby. Like, how do you approach that thinking? Like, how do you kind of expose yourself to that?
So usually exposure is done with the compulsion. So whatever you do in response to those things, you might have the thought, what if I hurt this child? And whatever your sort of ritual is, it's usually with OCD, it's called exposure and response prevention. So you expose yourself to thinking about these thoughts. So I have with patients, like, had them literally like type on a shared screen with me, like, what are the thoughts that are most scary to me? Or even if maybe that's too hard to work up to. So first we start with them just writing it down for themselves. And while they're doing that exposure, they also don't engage in whatever their usual ritual is. So they're having these thoughts and they're not doing whatever it is, tapping or doing an internet search to confirm that, okay, these things are actually not true, or whatever it might be that they're thinking about. Yeah. So if it's really based in a lot of these thoughts, we might purposely elicit the thoughts in a way that's scary, and then have them not do the response prevention. And sometimes too, doing those exposures to their thoughts, like maybe writing it on paper or things like that, also gives a little bit of distance. Like, I've had people be like, oh, it's so interesting. Like, I always had this thought, like, I'm a bad person because I had this image of me dropping a baby. But now that I see that written out, I realize, like, how does that make me a bad person? And it's not always that like magical that people are like and now I'm cured. I see how this isn't
but
so
sometimes
logical.
it is, and it's wild.
Yeah,
and other times
it takes time.
not.
It takes time. I'm not trying to paint this as it being it. I think I've had my own OCD things, and I know it is just like one of the most visceral experiences. I'm not trying to sugarcoat that. It is not easy to do exposure and expose yourself to those feelings. And again, you don't start with the hardest thing. It's not like we throw people into the lion's den right away, but it's the idea that like, okay, can I start with something that like maybe is somewhat manageable, that I'm going to only check things this number of times, or I'm going to write down the thoughts only to myself at first and not do my rituals that I would normally do. Next, I'll try writing them and sharing them with someone else and not doing my rituals, and whatever it might be. It's hard work, but it's really, really effective. So it's one of the things that I've seen be, on the one hand, some of the most difficult things to deal with for people mental health wise, but also on the other hand, one of the most effective treatments I've seen too. Like, we're really good at treating it.
It truly is. And when you tell someone, I've like, do you know how to stop it? It's actually to stop doing the behaviors. They look at you like you're crazy.
They're like, I would sooner die. Yeah.
And it is very shocking, but it works so well. I will say the one thing that, you've said that, and sometimes can help people if they're really just dealing with that intrusive thoughts side of things, is to remember that everyone has intrusive thoughts.
Yes.
They're distressing to you, but I think you've said before, like, to just think of them as like a cloud passing by.
Yes. Yeah, it's easier said than done, but when you do it, it's funny because people are like, how do I possibly do that? We do this all the time. Like, I'm having thoughts right now of like, okay, I'm going to shift in my chair. I'm looking at Allie. The next thing I'm going to say, I'm not really paying those thoughts much mind, right? Like, I'm just letting them come and then pass. And so it's the same principle that you start to kind of work up to with these thoughts as well, to just let them be. Because even when you do therapy for OCD or do exposure, it's not like the thoughts are ever going to like fully go away. Everyone gets them. It's just learning how to be like, oh, there's that little guy. All right. Like, let him walk across my brain and pass on by.
Yeah. Again, a lot of these things are easier said than done.
Yes.
But I want you to be like armed with the tools that this might be something that could help you.
Yeah.
And that if it's really is something that's distressing for you, to, go to a therapist.
Yeah.
Who can really, this is like bread and butter. Like, most therapists,
if they're trained in cognitive behavioral therapy, and
if they're correct, if they have evidence-based training, so trained in CBT, they should be trained in this exposure response therapy that can be truly like something that can, I don't want to say cure you, but like
it's like liberating,
make you feel so much more comfortable in your life. Like, it truly can. So thank you so much for listening to this episode, watching this episode. And by the time you watch this, Missy will have already donated.
Yes.
And again, just want to reiterate that you are a superstar, and I'm very proud of you.
Thank you.
We're laughing because someone in our life would call people superstars. And
I know, it's like a silly inside joke. Anyway.
Yes.
Bye, everyone. See you next week.
Bye, everyone.